seen him in his workshop yesterday, and so he is president of One Payer States, and he's got a very long list of, but he's a co-founder of Healthcare for All, and it still continues to be president of One Payer States. Is that correct?
Correct.
Okay, and so we have Chuck Pennachio, and then we have two new people that I know you will be so grateful to see, and I want to make sure I have this right. Felipe, who is with us. Okay, there you are. I just wanted to know you were right here. Executive Director of Hope Community Center. I'm just so grateful to know that you are an LGBT immigrant, and that is where you have centered a lot of your work. And I'm not going to take away any of your presentation, but wow, embarked on a 1,500-mile walk for immigrant rights, and so I'll let you continue to do that. And so we're so great to talk about that. And so one of the beautiful things I saw in here as I was looking at this write-up is that he wants to address the challenges of affordable housing, workforce development, financial empowerment, and all of that sustained by people who are healthy and able to get the work. One of the things about Medicare for All Act is that it's not just Medicare, it's enhanced Medicare, right? It's vision, dental. But one of the beautiful things that they're adding to that is mental health services and all of that. So the fight that we are in is going to help take care of some of those things and long-term care insurance as well. So we have living, and he is running for the office that is soon to be vacated by a state representative and Eskamani. And I want to thank you so much for being with us. Your Florida's fourth district. What's so cool about Anna is that you don't have to be just a middle Florida insider to know her face and to know her feelings. And I so appreciate your being able to represent us. And that's been such a wonderful thing. And so founder and executive director of People Power for Florida. And we know that you have served, and again, so many things, but we know that you've come to our Medicare for All Florida and enlightened us about your efforts. And so we want to thank you so much. You have signed the Patients for Over Profits pledge, and that's very important as well. So we have the four of you, if you'd like to come up, and we'll get you started. Thank you so much.
Our speakers just want to, join us up on stage, and you'll be able to speak one at a time. But we just, want to get that full picture of how great you all look this morning. Thank you so much for being here. Listen, you've already heard me talk too much already, right? And you're going to hear me talk more throughout the day. So I just want to welcome you here. I want to say that yesterday we did a lot of learning. Am I right? Yes? How many people here think they learned something yesterday? I know I learned something. All right, fantastic. So the question then becomes, right? We've got all this great new knowledge. We've got some new ideas about how to organize. We've got some new ideas about different tactics we can use, right? And now today, what we're going to do is start to think more practically about how we can actually put that into use, right? How we can actually use it. So you're going to be doing some exercises. We're going to be talking a little bit about 3 different kind of strategies that groups right now all over the nation are adopting. And we're going to see sort of test, right, how they might work in your community. So in order to do that, though, first, what we really need to do is kind of set the context and think about what is the environment where we're organizing. And so we have these amazing speakers here today who are going to give us some of that context. And I'm so excited to have them all with us. And in fact, I'm so excited that I'm just going to turn it back over to them. Thank you, folks.
Yeah, I can grab it off. Just it pops right out.
Okay, good.
Thank you, Candy, and special thanks to the nurses, Gillian and Stefan, and this wonderful collective of people at this meeting in a time of major crisis. I mean, let's keep it real. I've been organizing since I was a kid, and I was determined to go to school and understand better my own heritage, which is my American roots as well as my German roots. And that took me into a deep, lifelong study of the conflicts arising between democracy and fascism, essentially. It's a struggle. And it really, you talk about context, that's really the larger context we find ourselves in. It's an emergency situation. And much as we're focused laser-like on healthcare justice, it's absolutely essential that we think about global justice and that we think about social justice across the entire spectrum of issues that defines our lives. And it's out of that that I'd like to talk a little bit today about theory of change and talk about really essentially, and I'm going to drill down on a couple of these topics, but let me just relate to you this context of visioning. People talk about strategy quite a bit, values, principles, policy priorities, process. But for me, as a teenager, I picked up a book, some of you may be familiar with it, Edward Bellamy, Looking Backward. I recommend people do that, actually. It's a small novel, and it speaks to a transformation of the city of Boston as a visioning process. It's set in late 19th century Boston when it was a dystopian society, a society that wasn't caring for its people. And through this process, the protagonist in the story wakes up in the year 2000, about 110 years later, and he discovers that he's in utopian Boston. And I fell in love with this book because it gets at the very core of why it is that we're here. We care for people. And the story is about how did it happen? How did it happen? And so when we talk about strategy, the way I work at it is I put myself in that future space, that future place where everybody has healthcare and everybody has health justice, and we have a robust, bottom-up, participatory democracy, and that we're unified around the world, and that we're living up to the pledge of December 10th, 1948, the Universal Declaration of Human Rights. And for me, that's where we need to go, which is look backward at a very high moment in human history. You realize every nation in the world codified that in the year 1948? We haven't lived up to that, clearly. There have been points at which we've made great successes: civil rights, feminism, immigrant rights, disability rights, rights for the queer community, but they're fragmented and they're not sustained. And the question is, how do we sustain it? How do we keep ourselves together? How do we keep ourselves moving? And it does require a lot of discipline. It requires keeping our eye on the prize, as MLK would say back in the day, right? Eye on the prize, which is staying focused on a strategy that brings us all together. So for me, it really begins with this notion of visioning a future where we've accomplished our goals, our values, our principles, and our policies. But in order to do that, we need to double down on inclusion. And we need, especially oppressed communities, to help lead this fight and to be in partnership. And, here we're talking about, focusing on these, especially aggrieved communities, including Black community, Indigenous, Latina, Asian, immigrant, queer, and disability rights community, grounded in critical pedagogy. Each of these communities has its own method of binding, of working together, of culture connection, but respecting the critical pedagogy and the community building traditions. I mean, I think about Indigenous communities all the time, and I've learned so much in this work because not only am I running this 25-state consortium, One Pair of States, we were founded back in 2009. And our theory of change is that we're more likely than not to get to national Medicare for all through one, two, or more states or regions that model it. That's our theory of change, similar to what happened in Canada with Saskatchewan and so forth. But more than that, it's also doing what we call intergenerational work. So concurrent with the work of One Pair States, we've hosted a series of summits, intergenerational summits, that have focused on each of these communities and giving them platforms so that we're not talking just about healthcare, we're talking about health and what it is that defines the struggles within each of these communities. And that's also how you build power. Because look, I mean, the nurses are what, 250,000? And if you look at the single payer movement, as we call it, on a good day, we're not much more than a few 100,000, truly. But once we collect our energies and we collect ourselves with all these organizations and communities, now we've got the power. But it requires seeing each other as co-equals. Can't walk into a room and say, hey, healthcare is the most important thing when people don't have a roof over their head, right? You've got to focus on the needs of that community and be very intentional, I know, in listening and really working hard at, again, platforming, giving space, and giving leadership, development, contribution. So right now, how much time do I have? 2 minutes or so?
Yes.
Okay, let me just move toward wrapping this up. Let me just iterate here for you some of the core principles that drive the strategy building work that I'm engaged in right now. And this is we're developing. I'm in the process of developing with others a project that in many ways feeds off of what the right wing did, right? Which is to say the Powell memo, if you're familiar with it. 1971, Lewis Powell was hired by the Chamber of Commerce, a lawyer, to write this project, and the culmination has been Project 2025. And there's actually a lot we can learn from that. Pick up David Sirota's new book on that very topic, I would just encourage us to learn from that, because frankly, they learned from the civil rights movement. They learned from the grassroots organizing of the progressive era and the Great Society. There's no harm in learning from those who actually were opposed to. So let me just wind up by saying that this unified theory of change is really critical. We've got to respect each other's views on how we're going to achieve and accomplish change, but we've got to be unified in agreeing on core principles and processes and inclusion. And I really believe that that's the way that we're going to be able to move forward this project as well as all the projects that define all our lives. So thank you so much, everybody. Thank you so much.
So you already know that I worry about mispronouncing your last name. How bad is that? There's nothing, I mean, I think all of our names are important, and I just worry that I was gonna say it wrong. So would you mind saying your last name for me?
Absolutely. Hello, everyone.
Yeah.
Yes, I can use go for it. Hi, everybody. I'm gonna stand here instead of behind the podium. That's okay with folks. I'm Felipe Sousa-Lazaballet, and Felipe Sousa-Lazaballet, and I am here truly because this issue speaks so much to who I am and what I'm about. I came to the United States when I was 14 years old from Brazil. And I became, there you go.
Yeah.
I heard some Brazil lovers here. And became, you're Brazilian too? Oh, there you go. And I became undocumented, and I was undocumented for 15 years of my life. And in the same way that became, in many ways, a tragedy and a difficult moment in my life, it also gave the fire for me to get activated politically. And I first got involved with the immigrant youth movement. And in the immigrant youth movement, I learned that I have a voice, that I'm not a victim of my circumstances, and that when I organize with other people, we can create change.
Yeah.
But change doesn't come unless we're willing to put the work in. So when that moment came about, back in 2010, that President Obama was the president that had deported most people in the history of the United States. And that's something that we had to contend with. And what we decided to do was to march from Miami to Washington, D.C. And I say this because sometimes change feels so impossible. And you can imagine what it's like to be in a group of undocumented youth who said, you know what, we're going to fight for our chance to not be deported anymore. We're going to fight for the president to stop the deportation of dreamers. At a time that was sounded impossible, and honestly, some people literally said that we were crazy. And when we started that march, one step at a time, we made it all the way to DC, and we built incredible support, and that created the groundswell needed for what then became DACA. And deferred childhood for childhood for arrival. Deferred action for childhood arrivals. My goodness, trip on my own words. I say DACA all the time. Was nothing but a dream, but it was completely made possible by movement and by undocumented people, undocumented students. We used to meet with the White House staff on the church, on a church basement across the White House because we were not allowed inside the White House because we didn't have IDs. And that is how 600,000 people got work permits. To this day, people who no longer have to be fearing deportation, and the fight is far from over. But that would not be possible unless groups like this, moments like this, did not exist. So right before I came here, I got a phone call from a really good friend of mine. It's 7 a.m. I was getting ready because I was gonna meet with Anna. So we can drive together. And then he talked to me. So he's been in the hospital now for 2 weeks. He had a stroke. He's only 37 years old. And this happened because he had to take a blood thinner and he didn't have the money to pay for it. Without insurance, he would have to pay $1,000 a month for a medication that literally keeps him alive. And because of that, now he's stuck in a hospital, and God knows what's going to happen next. And in the process of being in the hospital, we just found out that he had an autoimmune disease that was undiagnosed, that would have been diagnosed had him access to a doctor that could be doing the kind of test that he needed. We're talking about someone's life that could literally cease to exist because he didn't have a little card that said, you know what, your life is worth saving. That needs to change, y'all. I am sick and tired of waking up with these kinds of phone calls. And I know that this collective desire for change lives within each one of you. So today I signed the Patients Over Profits pledge. And I'm excited to join many other incredible, progressive electeds and folks running for office, because here's the deal. As long as profit reigns over our lives and our health, we're gonna keep getting calls like I got this morning. And unless we're willing to do the work on the ground to organize across lines of difference, y'all, put ourselves in situations that may be uncomfortable, it will not change. And the lack of change means death. And that is a price I am not willing to pay. So thank you so much for having me here.
And so we'll turn it over now to Anna Eskamani, Representative Anna Eskamani.
Thank you. Yeah, Anna Eskamani. I so appreciate it. Good morning, everyone. Woo! I'm so grateful that we could join you today, and thank you to both Chuck and Felipe for fabulous remarks and setting such an important tone. I'm going to do my part to not only speak to this issue directly, but to also tie together the comments you just heard as we open up for Q&A as well. And something that really resonated with me, specifically with the Patients Over Profits pledge, which I was honored to sign at this point several years ago. The problem didn't start with poverty, right? The problem started with greed. And I think it's really important for us to remember that. We have poverty because of greed. Poverty is a policy decision that politicians make every single day when they accept checks from large corporations, when they consent to a regulatory scheme that benefits large corporations over the consumer, when they roll back regulations that have been established to provide balance, when they don't stop corporate consolidation or monopolies from forming. And so I think it's really important as advocates to ground ourselves in that reality that the problem didn't start with poverty, the problem started with greed. Now, when I look back at my trajectory in public service and my experience growing up in this community, of course, it all started with my family, like so many of us. My parents were both immigrants from Iran who came to this country in search of the American dream and in search of freedom. In fact, so many Iranians that left Iran to come to the United States had every intention of going back. And then when the 1979 revolution happened, for a lot of Iranians, they became refugees overnight without the status. And my parents were in that situation. They actually met at different times in their lives. They didn't come together. They met in Orlando, working the same donut shop. So, true American love story. Now, my mom was very proud of her cultural identity. My dad was not. He was hesitant for fear of prejudice and discrimination. But my mom recognized my dad's accent. They started speaking Farsi, and the rest was history. And so I do have a twin sister that many folks might know. My twin sister, Ida Eskamani, is also very involved in the political space. She now works nationally at Six, which is basically the progressive alternative to groups like Heritage Foundation, ALEC. And so she travels the country helping lawmakers at the state level organize around these issues and more. She does a lot of work on economic justice. She's partnered with Lena Khan on many projects. And so her and I were, late at night debating these types of conversations. That's what happens in my household. And then, of course, my big brother as well. So we grew up trying to make our parents proud. And like any family, there were many triumphs and also tragedies. And in our case, my mom was diagnosed with cancer, colon cancer, when I was about 9 years old. And she passed away in 2004. And my sister and I were just 13 years old. And as you can imagine, the exposure to our broken healthcare system at that young of an age sits with you. And not only did we have the trauma and the grief of losing a parent, but of course the medical debt that sat with us after her life. In fact, my dad and mom at the time were trying to move to a new home. We had a 3-bedroom house for years. I shared a bedroom with my twin sister and my brother until I was 13 years old. And so my mom was very excited for us to finally each have our own room. And as my parents were purchasing that home, my dad actually took out another loan, a mortgage on the house to pay off my mom's medical debt. And he's still paying off that today. And so it just speaks to the challenges, even when you have insurance. We were lucky to eventually have insurance through my dad's employer. Before that, we would go to Department of Health and other types of public service institutions for help. Even with insurance, it still wasn't enough. And I think that's really important to remember, right? Is we're fighting for not just the uninsured, but also the underinsured and people who are insured. Because right now, the insurance companies are denying you care for basic life-saving services, even when you are paying your dues, right? Even when you are contributing to the ecosystem. And so it truly is a broken system. And of course, without public options to balance this system out, it's going to continue to be broken. And so that brings me to kind of highlighting the work that we're pursuing in the legislature, but also the organizing work that needs to happen for us to be successful long term. Just like how we see divide and conquer tactics used against us in our work, we need to be thoughtful to how that can also be leveraged to bring people together on our causes. And Chuck mentioned this earlier, and just the coalition building needs to happen to expand these rooms. And I feel really lucky that when in the legislature, I get to interact with a lot of different associations, organizations who are talking about insurance companies all of the time, right? But often it's siloed environments. So for example, many of our organizations that represent doctors, whether it's FMA or maybe some of the more specialist associations, rheumatologists and so forth, they're always coming to us to talk about the challenges of pre-authorization. It is a constant theme. When the hemophilia groups come to us and talk about the need for blood therapies and preventative care, their number one complaints are insurance companies. I mean, it is just a constant theme. But when it comes to, have you ever worked with organizations like Medicare for All, or are you involved with the ballot initiative to expand Medicaid in Florida? There are these serious like knowledge gaps that exist. So I do think part of our success has to be kind of getting out of our comfort zone, right? And talking to organizations that we might not always be present in. And not trying to prove ourselves right, but just create a space to have a conversation that is led with wonder, right? Because I will say that a lot of these organizations, they don't always see themselves as advocates, right? They see themselves as representing their trade, representing their profession. But they don't always translate that to elections. They don't always translate that to how to coalition build. I mean, coalition building is one of the hardest parts of this work, like to be clear, right? Like bringing people together from diverse personalities and perspectives to go towards a common goal is hard. It is hard. And I actually, as a state representative, I do still work full time because our salary is only $28,000. None of y'all knew that, but being in the Florida House is a part-time job. So I also work full time, and I do work nationally around reproductive health. I should have mentioned before I ran for office, I worked at Planned Parenthood. So I know a thing or two about healthcare, and even the Planned Parenthood space, reimbursement rates in the blue states as it pertains to Medicaid has been a major issue. And no state has been safe to the extremism from the Trump administration on these areas. You even have health centers closing in rural Maine, known as a more progressive state because of the Medicaid cuts. And so now all the New England states are working together to figure out how can we protect our patients? What can we do to raise money from philanthropy in diverse ways to work together, not against each other, for these common and shared goals? And so we really have to consider, who are the untraditional allies, right, that we can invite to these spaces to partner with, and what is going to be the best messaging to reach different audiences. And this is really important because at the end of the day, if all it takes is for me to speak about a topic differently to not isolate someone, I'm very happy to do that. I'm very happy to do that. I mean, if I got to meet you where you're at, and if there are certain terms or maybe rhetoric that feels isolating or maybe feels elitist or feels whatever, like don't use it. We absolutely need to meet folks where they're at. And Chuck mentioned this earlier too, that when folks are struggling to afford a roof over their head, or struggling to find a good job, or struggling to keep their kids in school, whatever the challenge is, healthcare might feel like the farthest thing from their mind. And so you do have to approach it from the cost of living perspective. You have to approach it from a community-based level. And I think small organizing wins are better than none. And I'll give you a quick example before I toss it back for questions. So in Orange County, about 3 years ago, we were having a discussion about ARPA funds. This is the American Rescue Plan dollars. And I was talking with one of the organizers at Jobs with Justice, and I basically pitched to them. I was like, I read some other municipalities, they were using ARPA funds to eliminate medical debts. Like, have we considered doing that in Orange County? Literally, it was just like a pass-by conversation with this organizer. Like, we were just on the phone together, and I was like, yeah, I'll text you the articles, but I was reading in other cities that that's what they were doing with ARPA funds. So it started as just a casual conversation, right, between a lawmaker and an organizer, which, by the way, is collaborative governance. So it's the inside-outside strategy, right, of working with lawmakers to figure out how to solve these problems. Led to a countywide campaign that led to identifying allies in the county commission, that led to using ARPA funds to eliminate medical debt for thousands of Orange County residents. And you probably haven't even heard about that, right? Because that's not the kind of news, unfortunately, that reaches national headlines. But we changed thousands of people's lives, where now they can actually save money to buy that home or to send their kids to college or maybe to go on a vacation, right? And so don't put all, we have to fight multiple battles at the same time. I have that as a poster in my office. It's like, pick your battles, and it says, I pick all of them, right? So I think that's the reality of a lot of our lives, is that we're being attacked at every single level, whether it's reproductive rights, LGBTQ plus rights, immigrant rights, but to also remember the levels of government that intersect with those issues. And sometimes we can have some really impactful wins at the municipal level that can then supercharge the fight at the state legislature and the states federally. And so don't lose sight of that. Think about what could I do in my city council or my county commission that could help address the intersectionality of the healthcare crisis to make life better, but to also organize. Because now for us, all these folks that we mobilized around this medical debt issue are then going to be a part of the caucus that helps push for a Medicare for All bill in the future, or a part of the coalition to expand Medicaid in Florida, or helping to ensure that we have postpartum care after you give birth in Medicaid, right? So celebrate those wins. Don't always get lost in the losses, which unfortunately in our work, we have more losses than wins these days. But find hope in those wins and think through the importance of that hyper local organizing. And maybe that organizing is not your employer, right? Maybe it's pushing your employer to contract with a better insurance company options. One of the conversations I've been having in the property tax debate, which we're engaged with the legislature right now, the biggest cost that all our municipalities have come to us is about healthcare. Is the healthcare benefits. The insurance companies are just increasing all the costs, and whether you're a union trying to organize better benefits or the city government debating it, that's the biggest cost. Why aren't we creating public options between local governments? Like, why are there not multiple constitutional offices coming together and saying, we're gonna pull our staff in, right, and help create public options, or at least maybe we'll scale and purchase an insurance benefit for everyone. Now, granted, there's a lot of complexity in that situation to navigate, but I'll tell you, one of the reasons why is the lobbyists, or these insurance companies, don't want you to do it. And they are going to local governments and pushing, saying, you don't wanna do that, here's why. Right? And those same lobbyists are then cutting checks to the same commissioners who are not engaging in public options. And so I give you that example because, again, we have to localize these fights, so don't always get caught up in the national. There's so much opportunity for good right in our backyards. So thank you again, and looking forward to your questions. We'll share.
Well, we're good to have some questions, aren't we? 3? Oh, I've got the 3 fingers, so we have 3 questions. Would you like to ask a question?
Hi, I'm Emer and I'm a mom and I work in the community. I worked on the medical project with Anna and just regular people like me got 4.5 million ARPA funds and that helped initially up to 200% of the poverty level and then up to 400%. And I want to thank in particular as well, Felipe got us a letter from the Hope community to try and access healthcare. One of the reasons why I feel we need more than to appeal to good-natured representatives is the rest of them don't care. So we're going to need to think outside the box, have teachers covered in blood colour, because I'm going to die, even though Philippe got me the letter, and even though Community Health Centre tried to help, I developed a heart failure, and Medicaid still won't give me the medicine. So they're making determinations of who should die and who should not die. For the LGBTQ community, I want to say that the same crowd initially were following executive orders for trans healthcare, and now they've completely removed it. So instead of following law, they're actually too afraid and they're following executive orders, knowing that there's heightened risk. And I know this because I work with a whole lot of families in the community. So I guess I don't really have a question. I have a thank you. And yeah, more than appealing to goodwill, because as Sada Shakur said, never in the history of ever have things changed by appealing to the goodwill of, those in power.
Yeah.
I'm glad that you told our story. I don't care whether you had a question or not. Thank you so much.
Hello. So I feel like a big part of developing a decent strategy for us to get the things that we need to get, we have to also have a very fundamental and cohesive understanding of our enemy, of who we are going up against. So we look at open secrets. Representative Eskamani brought up lobbying, so we know that the health insurance lobby and the pharmaceutical lobby, just this last election cycle, the top 5 recipients, majority of those were from your own party. The top recipient in both pharmaceutical and health insurance was last year's Democratic presidential candidate. So, given that we have this understanding that the number of actual people who have committed to not accepting lobby money is less than 10, whereas a vast majority of 100 plus progressive caucuses are in the progressive caucus, but less than 10 Democrats don't take money from these lobbies. So my real question is how can we actually figure out or come up with a genuine strategy to get the things that we need if we are not actively building dual power with organizing as well as our politicians outside of our imperialist and capitalist controlled duopoly?
Yeah. I'm sure everyone has good thoughts, so yeah. Thank you for that great question. And that's a constant struggle for us, right? I mean, to be clear, when I first ran for office, like the Democratic Party thought I was the wrong pick for all these different reasons, right? And I flipped my seat from red to blue. We've won 4 back-to-back elections with like no assistance from that, right? Like, so I think it's worth stressing that there's so much tension between, I mean, I can only speak to myself, I can't speak for others, but there's constant tension between me and the FDP and the DCCC and like, you know, there's the inside-outside strategy, right, of us trying to change it from the inside, but of course there's also the great pressure from the outside, and we have to work together to change the duopoly structure. I mean, at the end of the day, there's 4 different types of leadership. When I'm on the House floor organizing a strategy to how to fight back against a bad bill, there's 4 different kind of quadrants I circulate between, right? You have the truth teller, the bridge builder, the policy wonk, and the spokesperson. And as long as we're aligned in who's doing what, and we're transparent about that, then we can try to either mitigate harm by amending a bill or stopping that bill completely. Or if it does pass, creating a framework for a constitutional battle in the courts. So you have to think strategically, to your point. But when it comes to like just money and politics in general, campaign finance reforms we desperately need. Like that will solve so many of our problems. But the expectation for politicians, whether they're red or blue, to change a system that they're benefiting from and exploiting from is close to impossible. So you really just have to push them out. And I mean, I'm very hopeful with the win of folks like Zohran Mamdani in New York City and just seeing history being made in parts across the country, that will set a tone, especially for kind of the old school type of Democrats, to move aside. If they're going to move aside, we're going to primary them and replace them. That's what it comes down to. But and that tension still exists for me too. I mean, we have a runoff election right now. If you read the Orlando Sentinel, you'll read about this morning, and it's literally old guard versus new guard. That's how it's being branded, and that's actually very factual to what's happening, right? I've endorsed someone different than who my mayor has endorsed, and we're all Democrats. So I think it's important to engage in these types of efforts. But the last point I'll make is, for me, it's less about left versus right and more about the bottom going for the top. And I do think that we have to expand our coalitions. I mean, I won 2 precincts that voted for President Trump in my district in Orange County. 2 precincts last cycle that voted for President Trump voted for Rep. Eskamani, right? And so that speaks to the populism that we lead on. It speaks to the corporate accountability that we champion. It speaks to our positions on things like the tourism development tax, which is a little more local to us in Orange County, but long story short, we generate $350 million of tourism development revenue every year, and it can only be spent really on the promotion of tourism, which is subsidized the private actors. And so we've been pushing to say, let's use this money for things like affordable housing, public transportation, and so forth. And so the last piece of advice that I'll give, honestly, is that it's a point I already made. Like, we gotta meet people where they're at. So if I knock on a door and I'm talking to someone about the duopoly, they're gonna be like, what are you talking about? I can't pay my rent right now. Yeah. You know what I mean? And so, like, I do think that political education starts at the hyper local level. And so I would think about, for example, let's just say there's a seat you're trying to win. You want to get someone elected. And by the way, if we're not, I know this is a see-through space, so I want to be thoughtful to how I phrase this, but if you're not thinking about election wins, then you're not truly committed to building power. I mean, I'll be very blunt about it, because we cannot get the policies that we need to get if we don't win more elections, period. And so if you think voting isn't important, why do politicians make it so hard to vote? And so we do have to organize in all these ways, and voting is not the end all be all to collective liberation, but my God, it plays such an important part of it. And so we do need to engage, but pick a candidate at a hyper local level that you're passionate about and educate the public about the opponent. And you mentioned transparency and open secrets. Look at state campaign finance, look at local campaign finance, because open secrets is only federal, right? For the most part. So you do have to look at who's giving money to who at the county, city, school board level, so forth, and do a campaign, education campaign about it, right? Like, let's just say there's a state house candidate you really care about. And I actually did this my first campaign. You know, we don't call it negative, we call it contrast, right? Because contrast is based on facts. Might not make the other candidate happy, but it is contrast. And we highlighted where money was coming from, like, you know, my donors versus his donors. And he was taking money from tobacco, he was taking money from insurance, taking money from all these different type of entities. And we just listed exactly where the donors came from. And that type of awareness, like, kind of helped shine the contrast of who was actually opening doors for everyday people versus who was going to open doors for corporations. And so I think just be hyper local with your advocacy and start there. And I think that type of, like, face-to-face canvassing, that type of belly-to-belly communication advocacy, you can build trust with folks that way. And maybe it starts with flipping a seat, or you know, maybe it starts with awareness about pharmaceutical companies, whatever the issue is. And that's not where it stops, right? You start there and you're like, oh, we won this election. Now let's push for XYZ policy at the city level, right? And I'll just provide a disclaimer that in Florida, unfortunately, a lot of good policies are preempted right now. So, for example, rent issues like rent stabilization, rent control, that is preempted by the state of Florida, which means that the state of Florida is going to allow local governments to pursue that in the private sector. Now, of course, you can get creative. If there's a city project with public dollars attached to it, you absolutely can do, to this date, still community benefit agreements, other types of requirements. But be mindful that some of our policy goals, or even ranked choice voting, the legislature has preempted. So we do have to know the landscape and think about, you know, the 5-10 year plan to change it. Nothing happens overnight. We have to remember that too, which is why my point about incremental wins is better than no wins.
That's right. I agree with everything Anna said. What I wanted to add to is a couple of things. So in my day job, I work at the Hope Community Center, and Hope serves about 20,000 people every single year. So the story we heard here is actually a story we deal with every single day. I call Hope the real. Because there is a difference between when I am in a group of progressives. Another thing is when I'm in the weeds with somebody who's hungry. And all they need is a bag of food. And it is my responsibility to figure out how the hell am I gonna get that food for them? That's how I see it, right? And at the end of the day, that's how the majority of the people in this country is living right now. And that is our collective responsibility. How do we connect with people who are in distress, but who have so much more in common with us? You have no idea how many people that come to Hope with their MAGA hats on. And we are an organization that is 90% made of immigrants. The staff of Hope is exactly the depiction of our actual mission. And then when they come in with their MAGA hat, we don't tell them to leave. We help them with their SNAP benefits. We help them apply for Medicaid, Medicare. They leave with a bag of food, and when there is a hurricane, we call them to see if they're okay. Yeah. That is the work, y'all.
Yeah.
And that is how you build trust with what we call unlikely allies, or people who have way more in common with us than they themselves see it. The second thing too is the political system is really hard, okay? I am not a typical person who runs for office. I'm an immigrant, from a working class family. I was not born in a yacht club kind of a situation, right? And very clearly, very soon said, I am not going to take this kind of money that's going. In Brazil, we have a saying, whoever pays for the band chooses the song. And and the song I'm gonna sing in the legislature gotta be a song by the people, not by the rich. So I'm clear, right? But it takes a high level of sacrifice to run for office, and also understanding that we need to build a bench of people like us in it. And we gotta support one another when we are in it, right? So when Rep Eskamani texted me in December, hey, would you run for District 42? I almost stopped reading. I like dropped my phone, immediately got nervous. Well, she's a good friend and very humble, but we know that Anna has fought for all of us. We know. So when somebody like her texts you with that kind of a question, right? Well, first of all, I definitely, paused, said yes when we met in an unassuming bakery by the Orlando airport. But really, that moment made it clear to me that sometimes we have to ask ourselves, if not me, then who? If not now, then when? And then stepping into the unknown and then push forward, because that is the only way we can actually succeed as a people. So there are these three key lessons that I just want to reiterate. One, be with the actual people and listen to them and don't judge them. Serve them, support them. And then two, when we have progressive people who come from the ground running for office, let's figure out how we support each other. And then third, when you are tapped in the shoulder and it is your time to step in, please consider saying yes.
Did you have something very quickly? I know we're running out.
Just really want to express appreciation for your words, Anna, Felipe. Appreciate it very much. The way I go forward in organizing is basically what you're saying: radical hospitality, radical hope, with eyes wide open.
Right.
You've got to your point about know thine enemy, you really do need to be clear about what we're dealing with.
Yeah.
And then radical love, which is the compassion that binds us in this room. And I'm just going to say, I'll give you my card. I wrote an article. It's entitled Fascism 101. See it, say it, define it, defeat it. And there are three core principles. I'm not going to get into this, and then there are 28 sort of accessory ways that fascism goes forward. But there's a lot of overlap between neoliberalism and fascism. We didn't have one without the other.
So we're not going to get to the three questions, as you can see, because we are already behind schedule. But can we please give our unveiling appreciation for this group of people? Oh my goodness, Anna, Felipe, and Gillian. I cannot tell you how beautiful it is to start off this day with this kind of inspiration. Thank you so much.
Yes, thank you so much. Okay, folks, a little bit of a change in schedule here. We're going to be doing a really super cool. We're going to be doing a strategy exercise, like I said before. And I am going to say, let's take a 5-minute break, just 5-minute bio break. And you can, hang out, make yourselves comfortable, and get ready for some strategy. In the meantime, I need Alex, Brittany, Rachel, Madly, Sophia, and Chuck to come up here right away, please. All right, guys. All right, folks, come on.
Yes, yes, yes.
If you don't remember from I'm sorry. And I was like, yeah, me too. I was here all day yesterday and I owe you a check and I'm really glad you're ready from here.
Sweet. Thank you for your leadership. It's so good to see you again.
It's good to see you too. Yeah.
It's been forever. How's it going? All right, folks.
Well,
All right,
I was
folks.
trimming it out in November. Yeah, so it's but retired and just
Doing the work. It's fascinating. I love to see it.
right.
Thank you for. All right, I need a shot, and I need to see you.
Oh, yeah, I'm sure.
Yeah, let's do it. Oh, God, thank you, Chuck.
Thank you so much.
Thank you.
You are awesome.
So appreciate you. Okay. All right, folks. Thank you. It's a great work. I think it's sincerely fun. So for theater, great. All the time. It's so I definitely feel okay about it. Yeah. Not yet. Or it's tough sticks. Yeah. So sweet. Don't worry about it. Thank you. Jen says, oh, fabulous. She was like, so noticing like, when it was surrounded to your house, you thought I'd really Thank you.
I know. I know.
All right, so pick it up. No, we're gonna have. Yes, I would like it if you could, but you can do some. Impact. Yeah, I think we should just, I think we should fix it.
I elaborate. We don't know.
After reading, we can start. Yeah.
So, Jennifer,
It's not.
Yeah. Or know about you. Did she knew something about you? Well,
That's correct. And I think there are just people in the so I think.
so I was that one.
All right. Yes. All right. Go team.
The way you see this, no, it's actually
Totally.
so honest actually. Yeah. Okay. She told me that. Well, they're gonna make a raping. Right?
I make coffee, so I can read what the group entails.
Just say she's the yes, she has running. Here's my thank you. But here's the mask. Honestly,
There you go.
I'd rather be insurance based versus something. It's either 7 or 8 weeks depending on much age. Some summers I have 3 months. Some summers like it's even I did not. So I'm just today. I love that. I was glad yeah. We actually are interns. Our sister program is and actually, I think we've shared with my interns. I had some undergrad, into the grad school, you're studying. So, like, so you're
Working in this country. Yes, because that's going to be a very we got lucky information. We got lucky because she had so many meetings. Hello everyone, hello everyone, hello everyone. How's everybody doing? All right, folks, let's just start to reconvene, see if we can start to, get back together. That would be awesome. If there are any folks in the hall, if maybe someone could just step out and give me my official yeller. Okay. You'll hear him in the hall again. All right, folks. All right.
I'm sorry I couldn't tell him. No, it's okay.
Okay. All right, is everyone coming in? Everybody in? Nobody out?
All right, folks. Is everyone here ready to get going? Yes. All right, let's try that one more time. Oh, that would be great. Yeah, I think someone already did actually. All right, who here's ready to get going? Okay, all right, I like this. I like this energy. All right, folks. So here's what we're gonna do. We're gonna do our strategy session, and in order to do that, we're gonna focus on 3 different strategies that groups all over the country are using this year and in the coming years in order to keep the fight for Medicare for all alive in a difficult economic and political climate. Does that sound good? Yes. All right. So what I need you to do is to pay attention to our first 3 speakers because you're going to be using the ideas that they're giving you in the exercise that we're going to be doing in small groups. Does that sound good? Yeah. Okay, great. Before we begin with our speakers, though, just so we don't have to pause in the middle for this, I'm going to have everyone count off. It's going to be a numbers challenge and an energy challenge. All right, ready? Do we have the energy? Do we have the numbers? All right. So, everyone who is not a facilitator, raise your hand, facilitators. All right. So, we're going to skip the facilitators. Everyone else, I want you to say a number. All right, ready?
Do I have to start with 1, right?
I'm afraid you do. Yeah. We're going to go from 1 to 5. 1 to 5. All right.
1,
2,
3,
4,
5, 6. No, back to 1.
It's cool. It's cool.
2,
You've really worked your shawl on. 3.
8,
4, 5,
1, 2, 3,
4,
5.
1, 2, 3, 4, 5.
Okay.
What?
2, 3. Oh, 3, 4.
Okay.
5,
1,
2, 3.
Oh, we got through already? All right, and now we're back here, right?
4, 5.
1.
Yep.
All right, okay, fantastic. Um,
2.
you're 2, just remember that, okay?
Number 2.
Okay, fantastic. Okay, so, I'm gonna start this off actually with an issue that we haven't really talked much about, but I know that all of you have been involved with in some way, which is that we're all really concerned about the privatization of the public health programs that we have. Is that right?
Yes.
Right? Do we want private insurance companies taking over our Medicaid and our Medicare? No, we don't. But they already are, right? They already are, and that's why we need to snap into action to fight it. So we're going to be joined right now by Aisha. Aisha is an amazing organizer, People's Action. And Aisha's going to tell you a little bit about how People's Action is working on deprivatization with a number of the organizations that y'all are part of this year. Everybody ready?
Yes.
Can we hear a little hi, Aisha? You're on mute, too. Aisha, you're on mute. There we go.
Yes.
All right, just give 1 second. We're having a little trouble hearing you. Aisha's pretty great. I'm just gonna do some pattern now. Aisha's pretty awesome. Aisha is also living in Texas right now.
Yeah, we're in Texas, so we're gonna together.
Oh, yeah, we all should get together. Aisha's in Austin.
Ooh.
Aisha also got some really cute dogs. Aisha's a pretty cool person. Are all of you familiar with the group People's Action? Woo! Yeah? Yeah? Who here's done some work with People's Action in the past? Great, great, great. Awesome. Catherine, I saw you said you had worked with people out of People's Action in the past. What have you done?
Well, I don't remember. I worked with a ton of years, but I know I've been involved with it. I remember being on a webinar with Aisha, but I'm on a ton of them, so I don't remember. Anybody else who works with People Action? Okay, here we go. Running. Sorry.
Hello, so I'm from Minnesota and we organized multiple protests against everybody's most beloved villain, United Health. So, yes, so we went back to that campus numerous times and had great organization efforts alongside People's Action and they were fantastic. So good to see you.
All right, I think we're not quite ready. Anybody else want to say any words of love, give some flowers to People's Action or their affiliates? I live in Maine. We have a great People's Action affiliate there in Maine, doing great work. All right, I'm gonna pass it to Brittany now.
Yeah, I'll give good morning. I've had 2 coffees.
You're not.
I will give a big shout out to People's Action Affiliate Progressive Maryland, who just got a new senator on a bill. They brought together labor, they brought together all these different groups to have a meeting, and importantly, Van Hollen for years has been like, oh, I'm on your side, but I don't want to get in the pool. It's too cold. And it's too hot. Yeah. Yeah, so he's been lukewarm about it for a while, and they didn't let that stop them. And they just, this is a lesson in persistence, right? Over many years, and this includes people who, were organizing before Van Hollen became a senator, right? And yeah, so big props to Progressive Maryland for this really big victory.
Okay, that is awesome. That is fantastic. Can you just flip off that mic really quick? All right, we're gonna try something here, folks. We're gonna try something unprecedented. You just say hi again and let's see if we can capture your voice.
Yeah, can y'all hear me?
All right, okay, just talk as loud as you possibly can. I's is a very calm and understated person. Talk loud and with energy.
I need to use my outdoor voice.
Please, yeah.
Yeah, I'm like up on a screen.
Mm-hmm. You are, yeah.
Great. That's an experience. Thanks for including me. Yeah, appreciate all of the love for People's Action. Yeah, like Gillian said, I'm Ija, Nemer Honoru, they say their pronouns. And we are healthcare work at People's Action. We're a national network with about 44 affiliates in about 30 states. And I'm really excited about this campaign that we've been working on with Pennachio and NMU. Big props to them. But basically, as Gillian was saying, the insurance companies have weaseled their way into our public insurance program, right? With Medicare, at this point, the majority of people who are on Medicare are on privatized Medicare, called Medicare Advantage. And the same is true for Medicaid, except it's actually a much higher proportion of people who are on Medicaid who have a private company that is the middleman, siphoning our public money into their for-profit fund. So what we're doing with PNHP and NMU is this campaign to deprivatize Medicaid, take the profit tiers out. And this is an important stepping stone to being able to get to Medicare for all, because it's about taking power away from the private insurance companies. It's also a good stepping stone towards a single payer. That's something y'all are working on. Now, you can get Medicaid to be true public, but that's a good basis for expanding it to everything. Basically, the idea is Medicaid can be better, and we've seen how this has looked in Connecticut, we've seen this in some other states. If you kick out the private insurers, you get better provider networks, you get better access to care, you don't have denials happening. And then at the same time, this is something that actually would save states hundreds of millions, or in some cases, billions of dollars. PNHP has a great report on this that sure we can send around if folks don't already have it, but it shows how much money each state would save if they deprivatize Medicaid, with some great data to back this up. That's a lot of how this program got privatized in the first place, was insurance companies saying it's going to be more efficient, it was going to save money, but actually, we all are unsurprised to know it could be opposite. So in this time when federal cuts are coming down to states and they're gonna have really harsh budgets. I think this is a great political opportunity to actually push for deprivatizing Medicaid, taking these profiteers out, so that more people can stay on Medicaid and get better access to care at the same time. And it's good because it's something that we can actually win at the state level while our federal government is pretty captured at the moment. Yeah, and then just some updates on, we've got 9 states that are working on this, including our networks, plus I know the awesome folks in Minnesota have been leading on this for a little bit now. And then, yeah, we've got materials that we can share around about like planning your state level campaigns, and the report. And I think that's kind of the gist of it. I can answer any questions if there are any, but.
Does anyone have any quick questions? Apologies. Oof, that's bad. Does anyone have any quick questions?
How do you get the link to the report?
Okay, I'm going to be sending that out to everyone who registered for this conference, so make sure that we have your email address, and I'll follow up with that afterwards. We'll follow up with some more information about really all the topics that we've discussed here and just how to get involved. That's great. Anyone else have any questions about Medicaid or privatization in general?
I should have programs that he's recorded that can also go out as a link or.
Isa, do you have like a recorded little spiel on this that I can share with them?
For a program that he's done.
Yeah, we've got ads from PNHC.
Yeah, all the thing.
Recorded.
Okay.
All right, great. So they were saying that Ed from PNHP has done a report on this, and we can share that as well. All right. Apologies. Isa really wanted to be with us today, but was unable to, and they demanded that we find some way to get them in the room. So, all right. Thank you all. Can we give a big round of applause for Isa? Thank you so much, Isa. Really appreciate you. Thanks. Yes. All right, folks. So we're going to launch right into our small groups. Does everyone remember that?
Can you remember impulse?
I certainly did. And my apologies. All right, so Brittany is going to talk next a little bit about another category of work, which is really the same category that she's been talking about all weekend long.
Great, awesome. So I'm going to try and make this brief. So how many of everyone was out my workshop on, just so I know how many need to, am I hearing an echo? I'm good, okay, it's just in my head. Okay, wonderful. Okay, so I was talking about, we often understand these as No King protests, No King's protests. I call it the pro-democracy movement because the national organizers would like me to tell you that No Kings is an event, right? But also I call it pro-democracy because it is a space of democracy in action, right? And also because it is the genealogical shape-shifted descendant of Occupy. And this was one of the things that we talked a lot about, right? And so, when we think about how Occupy worked, many of the criticisms of No King's, these pro-democracy mobilizations are exactly the same, right, that we saw from Occupy. Lack of articulated demands, there's so many things going on, there's too many costumes,
Not enough costumes.
Not enough costumes, too silly, not silly enough. But yeah, I was articulating the point that this is a public assembly space that acts as a zone of personal and political transformation for the people who enter it, because it is a space for mixing. And we all talked about how many of us, when we first entered into activism, met people and representatives of other movements that permanently changed us, right? And when we think about that, oh boy, inner child work, inner new activist work, right? And we think about how can we bring our message as a demand, right? Medicare for All is a movement, but it can also be a demand because it is in these spaces that the key demands of future elections are going to be forged. And sure, we can try and get national organizations to add it to an official list, but it's really up to how local people are mobilizing and articulating those demands to build up what is going to be the key demand, what are going to be the key demands of the years to come. And so we just talked a lot about, okay, how do you engage with that, right? Well, if you're running a petition campaign to get someone on the bill, or maybe patients over profits or anything like that, there's a lot of people who are going to be a lot friendlier to you there than you'll find at the farmer's market, especially in the winter if you live somewhere that gets cold. And then, if you have the Patients Over Profits pledge, a lot of politicians and political candidates like to show up at No Kings. They want to claim all that credit for other people's work, which is what politicians often do, right? Well, you can put them to work. You can say, hey, can you sign this pledge? There's also just a lot of unions and a lot of organizations that are doing amazing work show up here, right? And it is very hard to get those union locals on the phone, because they be organizing and they be busy, especially those teachers unions. That's where you find them, right? So this is also a really great place for coalition building. Let's say you're passing a resolution in your city council. I run the Medicare for All Resolutions campaign, by the way. And you want to get organizations to sign a declaration of support, just go to this. They might not reply to your emails. You don't even know who to email, but they're going to be there, right? And so that's the essence of it. It's look at these pro-democracy mobilizations as a moment of opportunity, a space for opportunity, a space to bring our movement in as a key demand for the future.
Yes.
Beautiful.
All right, and then the third topic that we're going to be discussing in our small groups is something that you've heard a lot about already this weekend, the Patients Over Profits Pledge. In case you were not in one of my workshops yesterday, I'll just very briefly go over what this pledge is. The Patients Over Profits Pledge, first off, is a pledge that's given to candidates and elected officials, and it's backed by National Nurses United, but also by a very, very broad coalition of pretty much any organization that works in healthcare justice, including, of course, Healthcare Now and Medicare for All Florida. So the Patients Over Profits Pledge asks candidates and sitting elected officials to pledge to reject campaign donations over $200 from the insurance industries, for-profit hospitals, and pharma corporations that collectively make up what we refer to as the for-profit healthcare industry. And the reason why we are pushing this pledge is exactly what we've been talking about this whole weekend. We know the healthcare system is broken. Everybody knows it. It is collapsing before our eyes. And yet, despite politicians on both sides of the aisle recognizing this problem, talking about this problem, bringing patients out to talk about their stories, they seem to lack the political will to enact the bold solutions that we need to address the problem. And why is that? It's because, as was so aptly pointed out earlier, most politicians on both sides of the aisle are taking huge amounts of money from the corporate healthcare industry. In addition to campaign donations, of course, the for-profit healthcare industry is some of the leading actors when it comes to lobbying. The pharmaceutical industry is the #1 spender on lobbying. The #2 spender is the for-profit insurance industry. So they're spending huge amounts of money, both through lobbying and through political donations, independent expenditures and such, to make sure that despite lots of rhetoric about our broken healthcare system, bold change is never really enacted. We tinker around the edges. We do things like the ACA where we funnel even more money to the private insurance industry. But the political will for Medicare for all is not there, despite there being, huge, overwhelming support for Medicare for all among everyday people. So we think it is critically important, if we're ever going to see real change enacted from our elected officials, that we get them out of the pocket of the for-profit industry. So that's what the pledge aims to do. Sitting elected officials can take it. Candidates can take it. We have, after this weekend, 343 signers, including Zoran Mandami. Yes. Including Anna Eskamani, including Felipe, actually, if you're in the room and you've taken the pot pledge, please stand up. Please stand up. There's several of you. Yes, thank you everyone in the room who has taken the pot pledge. There's too many people for me to even name out. So this is, we see this being a real valuable organizing tool as we move toward the 2026 midterm elections. Healthcare is absolutely at the top of everybody's mind right now. As I said before, the system is collapsing before our eyes, and everybody's talking about it. So we really think this is our moment to bring this pledge into the conversation, to hold our politicians accountable, and really keep healthcare at the top of the conversation as we move towards the elections. So that is what the Patients of Our Profits Pledge is and how we use it. Does anyone have any questions before we move into small groups?
Yes,
Yes.
my congresswoman is Debbie Wasserman Schultz. So how can I pass this to her? What should I do?
You can just ask her. I mean, you can email her. You can, call her office. I would say I doubt Debbie Wasserman Schultz is going to sign it without severe public pressure. So, I mean, that doesn't mean you shouldn't bring it to her. Everybody should hear about this pledge. The more we get the name of it out there, the more name recognition it will get. Sort of like build it and they will come kind of thing. And we think that eventually this pledge could be as big as something like the No Fossil Fuel Money Pledge. And that's when I think people like her will start to fall in line and pay attention. But it's going to take a lot of hustle on our part to get the name recognition and get the reputation up there first. All right. Thank you.
Sounds great. Good luck with Debbie Watson and Michelle. All right, folks. So we're going to break into our small groups. Now I am going to, I'm just going to make a really quick schedule change here. We were going to reconvene for report backs at 12:15. Now we're going to reconvene at 12:30. We'll cut short our closing and we'll wrap everything up and get everyone out of here on time to go and make their flights and whatnot. Does that sound okay to everyone? Yeah. All right, so you basically have 1 hour in your small groups. Who is facilitator number one? Okay, if you're a one, you're with Alex. Your group is actually going to be filmed as part of the live program. If you are two, you're with Brittany. Excellent. And if you are three, yes, very good. So you are with Sophia. And if you are four, yes, you are with Rachel Natalie, the girl from New Jersey. And if you are number five, last but never least, you are with Chuck. Everybody cool with that? We ready to go?
Where?
All right. 1, 2, 3, break.
Where we going? Oh, everyone's getting here?
We're going to be at group one. Right here. Group one.
Sorry. Maybe they're meetings. No, you're good. Oh, sorry. Sorry.
Look, by the way, do you see this thing? I see that one is from the other one, so you guys don't forget.
Okay.
Has been there since yesterday.
Okay.
Yes. So bad, just because it's right.
Yeah.
Is this
This is going, it's a lot of one.
More space. I know it's a little bit of a large room. Feel free to spread out wherever you want in the building. It's the you know, in that room, whatever you want.
Let it pass it on to some person and have them make use of that idea.
Okay. Good.
Yes.
All right, so here's the plan. I know it's like we have about an hour.
Don't be shy. So sorry. So sorry.
So we all get to know each other better. We're gonna talk about what the exercise would be, a little bit of like goal setting. And then we'll spend 15 minutes on each of those three strategies that are deprivatization, the bringing Medicare for all into the pro-democracy spaces, that spaces, and the patients over profits. We'll actually spend 15 minutes on each of those and then wrap up. So before we get into introductions, though, when we go back together as a large group, somebody is going to report back on behalf of our group. So I would love if we could figure out who that person is going to be now, so that that person can take notes along the way. Who feels like they would like to do it?
Candy's volunteering herself.
Yes.
I can't because I have to purpose.
All right, Candy's been doing a lot of talking.
I don't just go. There you go.
Chad.
Okay.
All right.
I mean,
All right.
I'll take notes on these.
Okay, thank you. I can also take paper.
I have horrible handwriting, so I think I will take these quickly so I can read them.
Okay,
Right.
great.
Members of Alex's group, I'm sorry, I'm just gonna have to ask you if you could speak loudly and clearly as examples for the rest of the movement watching online.
Okay.
I really appreciate it, thank you.
All right. So I'm not yelling at you, I'm yelling with you. Okay, so let's do quick introductions. There's a lot of us in this group. We don't want to take up too much time. I'm going to ask you to very quickly go around where you say name, pronouns, where you live, and what's one thing that's special about where you live. Very briefly. Okay, so I'll go first as a example. My name is Alex. My pronouns are she, her. I'm located in Southwest Harbor, Maine. And one thing that's special about where I live is that I haven't had to lock my door in 6 years of living in my house.
My name is Andrea. I'm from Valparaiso, Indiana. What's special about where I live? I'm in Indiana.
I'm Candy Burke, she, her. I live in Gainesville, Florida, and it is a very tiny little wonderful dog in the elbow.
My name is Catherine Lewandowski. I live in Washington. I'm she, we, us. And I work, I guess the most special thing is I'm like right on the foothills of the Cascade, a blue dot in a very red district. And it rains all the time. It rains all the time. You don't want to come live there.
Chad, he, him. I'm from Winter Park, Florida, which is just outside of Orlando. What's great about Winter Park, we have excellent local utilities that are part of the larger our city companies that are much better than surrounding areas.
I'm Tara Connor, from Rockledge, Florida, and she, her. There's a lot of things I love about Rockledge. I love the tight-knit community feel. I love being close to Orlando, Disney, theme parks and fun things to do. And still being outside of the traffic and stuff.
That is she, pronouns, and I'm from Winter Park also. And I like that we have old trees, lots of new development center. We have orange trees. We're also represented by animals.
I'm Judy Lerman, she, her. I'm from San Antonio, Texas. I know that it's been done every day. And it used to rain, but it doesn't anymore. The state of trees is pecan and trees, yeah. So I'm here in Houston, from Cocoa Coral. Right down the street here, when you cross the light, the next light, you're in Cocoa. What's interesting about this area is we're close proximity to get a lot of traffic from everywhere. Really, the area's too small for all the traffic that we have. So we're lucky. Other than that, it's not that a good My name is Jackie Sugar. I'm from Weston, South Florida. The location would be west of Holiday, the last city before you get to Allegheny Valley, 75. And it's a very conservative new city, I'd say 40 years, maybe built. So it's modern, it's very safe, and I'm a representative where he was.
David Perry, Plattsburgh, New York, to him, and I'm almost Canadian. I'm 30 miles from the border, so I'm very familiar with their healthcare system and you know.
Okay, well, it's really great to meet all of you. Thank you for being here. My question to you is, out of the three strategies that we heard earlier, deprivatization, Rockledge, pro-democracy, was there one in particular that stood out? We can just raise hands to go around. Is there one that kind of spoke to you? I know they're all good, right? But is there one that really you got kind of really fired up hearing about? Yes.
Privatization.
Okay.
Well, I've worked in healthcare my whole career, and it poses the greatest risk to the future of the healthcare system. It's just taking dollars from care and putting them in other people's pockets. I don't care whose pockets they are. It's not the workers, it's not the patients, but it's somebody else's pockets. And that money should be going to care, number one. And until it gets redirected back to care, we are going to have a failing system.
Yeah.
Especially, I think with Medicaid, it's dollars that is supposed to be directed for the poor, that's being moved back into the hands of the wealthy.
Yeah.
The strategy to get to this is, I think, the pledge is the first step.
Okay, so you pledge spoke to you.
Yeah, because we are not gonna get to back to what it was before without the privatization, without the pledging that they wanna be on our side.
It's all connected. Yeah. Anybody else?
I was telling Alex, I think it's a good idea, if you go to any talks where you've got your politician talking to you and they introduce them, I think the first question you should ask is whether they've taken the pledge. If they haven't, everybody should walk out.
They don't mess around in London. All right, anyone feel particularly fired up by what bringing Medicare for all into the democracy space right now, the fight back space right now? At your local Kings or whatever.
I really loved the idea, but I think when I went to another King's thing, I was the only one that had a sign that had healthcare on it. Because they were so mad at the individual and all of that kind of stuff. So I felt like my message didn't get across, so.
And I think that's exactly what Brittany's talking about, is how can we shift that? And I think, tell me if you agree, I think it's gonna get easier now.
Yes.
Because healthcare is really, like I said earlier, it's collapsing right now, with what happened with ACA subsidies. Now, I think people are gonna be very angry about it, and the next level is gonna respond.
Yeah.
All right, great. So what we're gonna do then is kind of go through these three strategies one at a time. We'll spend about 15 minutes on each one, talking a little bit more deeply about it, and really though thinking about how you might work within your community or your organization on each of these three things. And that's the goal of this this workshop, this strategy session right now, is to really get you thinking. I said this in my workshop yesterday. I think when you come to something like this, you shouldn't full time. The goal of coming here is to to flex the muscle of taking action. So I want you to really think right now about how you can take action in your community on each of these three topics. So first, let's start with, we were just talking about the pro-democracy space, so let's just continue talking about that one. So what I want you to think about is, why do you think this might be an effective strategy in this moment? Is there any reason why you feel like it might not be an effective strategy?
Trying to come in at a time where people.
That's my first question.
Yeah, no, so I mean, just piggybacking off what you were saying before about the timing, I think in June, July, when these things actually kick in, people being kicked off their coverages next year or
January, I thought.
Oh, is it January? Oh, okay. I think it's only, like you were saying, it's only gonna accelerate that. So we're shifting the message now, so it's on people's heads before it starts just tying things together. When, like Smoke Kings, here on City Council. And right now, pushing that to help their encouraging.
I have to pick up the news, but I just read something like last night that they're working on a bipartisan deal to extend the tax subsidies that are gonna, because I think you're right. That would make it a turning point, and they see that, and so they don't want that to be exposed before the midterm.
And
Both of them.
primaries are in March, which is not.
Yeah.
So.
It also feels like we're a year into the Trump administration, right? It's been block work up to this point, right? Fight back, putting out fires, and now perhaps as we're moving towards the midterms, we're talking about what do we stand for? What is the better option? Right? So I think that we're at that halfway point between elections, and I think we're starting to shift there. So to me, that's what feels like there's a good timing of this. So do you think that this strategy would resonate with people in your community? The people you know who are going out to King's protests, fight back protests, do you think that they would, how do you think they would respond to hearing from you and saying, you said, we should really try to talk about healthcare in this one? What do you think they would say?
I think that's a very positive. And I think, I don't know if I'm the only person who thinks, but I really have this gut feeling that what we're seeing in terms of the impending COVID. If that were to really happen, I think that would be the collapse of the US economy. That would be a major.
I read about that too. I thought, what if we take back all this money from the for-profit insurance companies? Is that gonna collapse like the market and all that stuff? But then I started thinking about it. If those dollars get put back into all of your pocketbooks and you are now able to spend it, that's actually gonna stimulate the economy. Yeah, so I don't worry about that anymore.
What was it yesterday? There was someone who presented some huge amount of health economists. Yes,
326.
Yeah, it was Dr. Yeah, make it toxic to profit off of healthcare. And start talking about you should be profiting on families being able to go on vacation, families being able to buy a house, families being able to feed their kids, things like that.
But is that what you were talking about?
I don't think they're going to say it. I think that's why they're working. I think we should be there to explain why they're working on this bipartisan. Because they're so afraid of people. Everyday people.
Right, and when, if you're talking about going to the protests, then you have to have a coordinated visual, because every time I turn around, there's everyone close to an action, and there just isn't anybody who doesn't recognize that t-shirt. All right, and so if you're going, I mean, for me, standing in one place with a little sign, but organizing so that you have a group of people who are wearing healthcare is a human rights thing, and a sign that goes along. It will, the little nesting of people in groups to say, well, it's not that just that one person.
it's a group of people who have the same thought, and then that starts to close the conversation against individuals.
Well, a lot of times when we talk to people in public, plans, right? Like the heart like this, everybody wants to get those. Maybe they don't know because and giving people an easy in. And I know I'm kind of jumping to the pledge, but like that's something that's extremely tangible from the volunteer. So not that it's a pledge that you talk about on a daily basis, but something actionable that they can do next weekend or weekend after that. That's what people really want because they're mad, they're angry, they're upset, they don't know where to come back from. That's why they go to a protest because they do something to show, hey, I care, I.
That's a great segue to my next question. So, this can seem like an ambiguous national goal. What are ways that we can take this goal and make it manageable at the local level? So I want you to think like concretely. What's something that you could do concretely in your community to bring Medicare for all and healthcare as a human right into the conversation at your next mass focus?
I mean, but I'm sorry. In Florida, you know, they take all the time at every festival that there is all over the state. And so in mine, and we just did one at in Gainesville. And honestly, our guy just had a little thing that said, we don't want to redistrict Florida. And we just had this little thing, and you just signed your name and your zip code. That's all you had to put down. So much information. And then we were gonna take that picture to the legislators and say, these, I mean, this is 100 people at a table event. So it was as simple as just writing your name and a zip code. And they felt like they left our table feeling like they had done something. Does that make sense? And not only is it in the heart now, but they've done something. So, and that was my idea, just yes.
Yeah, because a lot of people don't like to give out all the information. Emails, text messages, oh God, I'm pretty.
Email part of it. Sign your name and yeah, I suppose it's, most of the time they don't come to your table if they're wanting to scam you. You know, I don't know, they're.
Well, no, but if people don't want to sign something, put all their information.
I told
And I love that idea. Yeah, I love it.
Well, there's a lot of
Leaning in.
that happened to me one time. I was talking to the press, and all of a sudden the camera came. Anyways, I represent labor for years, and one of the things that I had to do was be responsible was go out and in the community and build coalition, join everything I went out to talk to. Everybody I went out joined. And that's one of the ways you can do it. You can, all these local groups, you can be the person that brings them together, you know? Because that's what we would do. We would invite them down for a community conversation with labor. And once we got in the room together, then we decided which direction we want to go. Right now, I'm the vice president of the Space Coast Progressive Alliance. And we put on lots of informational program. We had Anna, different people, you get a subject, you put it together. So a few people that really work hard on it, and then we put it out on the internet, people come. And so that's another way,
Love it.
Yeah.
All right, so, sorry, anybody else want to add anything? Yes.
I attended my city Democratic Party used to their first annual picnic, and I think that would be a great way to get the message out there. Get the word out about the picnic, people in for that, and be able to get the petitions going, and also get the message out to them. See how many people are actually.
I mean, that's the reason I'm here. Me too.
That would be a great place to give people the information about the pledge. Imagine if after the King's protest, every city council person, including the mayor, got 20 emails asking them to sign the pledge and sponsor a resolution. Imagine their jaws dropping.
Our Medicare for All also started the fall of the Congress, but money back. go over there and call him once a week.
To say hi.
Yes.
I was just gonna say, like, finding ways to contribute to the work that's already being done. So like, actually, we have different sites just presented about how they're trying to get specific things on the ballot. So if you show up with those petitions to support them, and so she said up here. These people who show up, invite them to go at the county commissioners meeting. I have some reservations. Somebody said, what's our interest? We'll all go together, 9 a.m. on a Tuesday. We'll do some big groups, we're gonna make it so like you said, invite people with food. Afterwards, we'll have dates. To just go speak and vocalize what it is we want.
Like during the public comments.
Yes.
Yeah.
So great. That's a great transition to my next question, which is, every campaign begins with sharing your base and your allies. So I want you all to think about who are the connections you might want to make. If you were going to bring Medicare for all into the conversation before your next mass protest, what are the connections you need to make? What are the allies that you need to connect with? So I want you to think about two people or groups of people. One is a usual suspect, right? So like our progressive group, natural allies, someone who's already working on healthcare justice. And then one, I want you to think outside the box, a group that you might not think of as political, or maybe they're more policy driven. So this could be, for example, a faith congregation, a local civic club, something like that. So if we were going to set a goal, if you were going to set a goal before the next, I'm just going to call it No Kings, before the next No Kings protest, you want to make sure that healthcare as a human right is centered at that protest. What are two groups, constituencies you want to connect with before that?
Organized labor is the first one that comes to my mind. And it's a mixed group. There's those that are very much for Medicare for all, like NNU, and then there's those that are very much opposed, like the building trades. And this makes it very difficult because they're all your brothers and sisters in labor. And so you have to find the common ground with all of them. And even if they're under the same umbrella, they don't necessarily seem to understand the storm that's out there. But anyway, I'm not sure about the other group. I mean, the first thing that came to mind was like the Parent Teachers Association or something associated with schools, where the families are a real mix, socioeconomically and in every way. Whether or not they would have any common ground, I don't know. I'm a few years away from that group. So.
Organized labor is, the issue with organized labor is they, like our USW, and they generally speaking in the country, they have better benefits than most. And they're very hesitant to, talk about discrimination.
But it's most, you said most, it's not the best.
No,
but
we're
it's
not
better
politicians.
than average. Right, yeah, no, I wish we had the benefit Congress had. That would be fair. But the other thing is you lose your job and your benefits disappear.
But to go off that same message, I think if your messaging is there's nobody better than the union who understands the power of organization, and they should want that for everybody. So it's not to lessen what a union has, it's to spread their message. Be like, you need this as well. You can't organize your workforce how else is organized to get those same benefits.
Just as information, South Florida, there is no organized labor. I'm in the medical field and it's zero, so.
Yes, you guys are in here right now.
even university faculty.
So I just want to say, you talked about the PTA, I was thinking, I wonder if maybe try to engage more with our school board. You know, presentations at the school business. If they're kind of like.
Okay, so
That I
this
missed.
next part individually, we may have different thoughts here, right? About the in the box group and out of the box group. For Virginia Medicare for All, the pro democracy fight back space. I want you to think about those two groups. The instructions here say take out 2 sheets of paper. You may not also you can do this in your phone notes or just in your head. And write down the names of the two groups. So the in the box, the usual suspect group and the out of the box group. And I want you to think about what is your shared interest in this community. So just as an example, okay, if my in the box was, local individuals chapter, we probably organizing the protests, right? Okay, what are our shared protests? What is our shared interest? We both hate Trump. We both hate the way that Trump is attacking the healthcare system. Trump, Republicans, that's the shared interest. What are the strengths of this group that make it a great partner for this effort? It's easy. Indivisible is they have a lot of momentum and the influence right now in holding the space for these protests. They probably have a good email list. Okay, that's the strength. How can we best approach or make contact with this? Right? I know the person who's one of the organizers, reach out to them. And then how can we build trust and solidarity with this group? We have to say, when I reach out to them, I say, I'd like to volunteer to be a speaker at the event. And then also, I'd love to talk to you about bringing healthcare into the conversation with our messaging. That's just an example. So I want you to think about your usual suspect and your out of the box group and think about those questions. Just quiet thinking, writing. What is your shared interest? What are the strengths of that group that would make them a good partner? How can you best approach them? And how can you build trust and solidarity?
Building dual power, I don't take it seriously.
The problem is that the top tax rate, this is just really in the box.
We have both.
Oh, wow. It's somewhere around 3 or 4.
A few minutes to getting it back for healthcare, so do that.
It hasn't officially launched yet. We're going to see how been affected by the healthcare system from locking down.
That makes sense.
Medical debt, enacting things like that.
But then it goes down to kind of what they were talking about. Okay, well, how do you organize? Is this people donate their services? What you can
I just
provide that
say
for.
that's one thing.
Because I think they're talking about getting gatherings.
That I feel was kind of missing, not.
Yeah, that sounds like. But it's a way to.
My inbox. In the box. Please go to we already know things.
What's your shared interest?
Our shared interest is community, basically, getting the word out about things that are actually happening.
And what are the strengths of the group?
The strength of it is that we have a vehicle set up, we get out and social media, we're on Facebook, we provide events all the time. And we're up to date on what's happening,
Seeing the circumstances are good.
some of the things are violence. Politics, we have forums, we have all sorts of things.
That's just
What's going on? Politics.
Sorry, I can't hear you. I'm sorry.
Okay.
All right, and then I don't think I need to ask you how you make contact with the group because you are the group.
Yeah.
And then how you can build trust and solidarity with the group. You are the group.
Yeah, we kind of all, yeah, that's it.
Cool. Okay, thank you.
And so for the out of the box group, one of mine is Eagles, yeah. When I go to the Eagles, and I joined them because I was going for karaoke.
Sorry, can you explain what the Eagles are?
Yeah, the Eagles it's a fraternal like, sort of like.
Oh,
It's
like
like
the
the Lions and
Yeah.
the Blues Club.
Yeah,
that's a good.
I thought you were talking about the Philadelphia Eagles.
Oh, right. So when I walk in those doors,
This is a different generation.
so when I walk through those doors, I know automatically what I've seen their heads, seen the buttons, seen those things. So I know that politically we're not on the same page. But I used to go sing karaoke, and I made my little line in the sand, and I said, well, we're gonna talk. We're not on the same page, so no, we're not gonna talk about it. But I've mingled with them. I've gotten to know them. So basically, we can start talking together about some of the things that we haven't. That's what you start doing. You let them know there's things that we haven't. And I might not agree with everything they say, and they don't agree with everything I say, but we have a conversation.
Yeah, yeah.
Yeah, it happens.
It is so wonderful because I know that there are people in my world that are very, very Republican, but because they know my stance, they pay attention to my, so they don't necessarily agree with me, but they know where I am.
Right.
And the very fact that we have a relationship, because they pay attention to us. It's a good point. I had
You have to step out.
gotta be in all the rooms.
Is there one more person who wants to share their two groups just briefly before we transition to the next topic?
Okay, I thought of, so I remember, I'm a retired member of SW. I have run into some opposition. My local, they would not allow me to make a presentation at their local, I was just shocked. I'm gonna, continue my efforts in that. Also, I'm also a member of SOAR. It's the Steelworkers Organization of Active Retirees. And our chapter actually supports the Medicare for All in a small way. Like they have booths at expos, they share. So, that's good, but, the idea that brought to my attention was like the Eagles, Lions Club, CFWs, American Legions, start work sessions, trying to make presentations.
Right, that's great. Awesome, okay, all right, so we're gonna transition now to talking about some expectations of our office. Before we do that, if you're physically able, if not, just using your seat, stand up. I want you guys to shake it out, jump up and down, wake yourself up. Clear your mind. Right, wiggles out. Sorry, former preschool. Okay. All right, so all those same questions that I just asked you, right? I want you now to shift to thinking about those questions around patients or profits question. So why do you think this might be an effective strategy at this moment? Is there any reason why you think it might not be an effective strategy? I would say that
I think it's really tough to get most politicians to sign up because they need the money.
But I also believe that organizations set up impact trackers. They have been paying politicians, and we have politicians return money to impact. It's true. So shaming can work.
Especially if there is a database that shows the tolerance to publicly show. If you don't find it shameful, that's fine. But these are the numbers, and everybody should be open about what they receive.
You can find out how much money if you get here. I'm not very good at it.
Oh, but and there's so many politicians, so much money. It takes an organized group to put that together. It's not. It's not just.
Healthcare is going to be more difficult, right? APAC has a lot of lobbying. You're focusing on that specific one, there's more cases, we have to look at various, yeah.
Tara? So, which one is it? Tara. Tara. Okay. I was babysitting my sister's name Tara. I always ask her, Tara or Tara? And she goes, it's Tara, either one. Anyway, Tara, as, not to put you on the spot, but as an actual elected official, I would love to hear your perspective on this. I know you signed the pledge yesterday. We've been pushing, hyper local, like they're not giving you money anyway, right? To decide, but sometimes they'll say, um, why does it matter if they're not giving me money. It's helpful for us to hear, what inspired you to take it, how do you feel about it?
Well, you never know what will happen in the future, right? And I think it's important, even if we're maybe not actively taking the money, maybe someday it will be in our lap to make a decision, and it will create that thought process. Or it's things that kind of come about the last year since I've been in office that I have not even thought like I'd have to think about. And so I think it's good to preemptively get people thinking about it, even if they're not in a position where they need the money at that moment. Because it's easier to make that decision when you're not in that moment. You don't have to, release $1 million from to figure out where your stance is.
Thank you. It's great. Send a signal to people who might have tried to,
So yes, and how would we advertise that we signed it? Is there a way like we can
Social media is one way, it's on your website, graphic, some people.
I'm not good at thinking of the social media aspect of it, and I need to engage that part of my strategy, I guess, moving forward. When we see other people in our positions, it's like, they're thinking about us, maybe I should be thinking about us. We all have meetings as elected officials in our whole county. Look at each other's Facebook pages and see what each other is doing on their friends, and I feel like it's important to verbalize and educate. Like, this is important to me. This is something I'm thinking about. This is something I spent my weekend doing because I think that there's so much I have to learn and to communicate, educate.
Do you have to vote on health insurance for the employees of your city, county, whatever you're?
Yes.
So do none of the companies that have a vested interest in this try to influence your decisions?
It goes through as like a brokerage.
And the brokerage doesn't take you to dinner or?
Yes, it's not perfect.
See, I mean, in healthcare, I could eat out every night of the week as a nurse practitioner. Drug companies would take me out to dinner every night of the week, one or another drug. And that adds up to $200 real quick. Some restaurants, they take us to one dinner.
That's true.
So those kinds of things are some of the influences that are happening that maybe not to you yet, but next year.
Yeah. Okay, so thinking about the pledge, is this something that you think people in your community are excited to work on?
Well, only because I live so I speak to the members at their house. So I just don't see it as being a big thing. I think they could do it, but I don't. It's a shutdown. It's a debate.
They won't because their minds are. Yeah. I did, and I just got to go something. They're not interested. You can talk to them, but you gotta have a personal relationship with them somehow to bring them around. And it's gonna be the same few of us at this table that's gonna be out there. Rah, 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 rah. But they're like, okay, whatever you come up with, that's okay, because they don't really understand what it's all about.
So hard to like Jackie said when he was from, everybody was like, good luck, Jackie. You know, like, because we understand how much they're gonna like ignore or push back against this idea. It's just maybe some lessons, different it's probably like
Things like I just don't have time. Yeah, do what you want to do.
yeah.
I need you.
And every single person has a story of how they're personally affected. But I think everybody's always focused on the loudest piece that's in the news, the loudest thing that's going on, and they're not necessarily thinking about, oh, there are some promises to solve this. And the ice cases, they're looking at something more in your face. Unfortunately, at this moment, that's how I feel like we're going.
Even Marjorie Taylor Greene didn't change her song until it was her family that was going to be impacted by the insurance price increases. And then suddenly it's like, oh yeah, we don't want these subsidies to end. It's like, whoa, MTG, where are you coming from?
Yeah. This is something we say a lot as healthcare justice organizers is if healthcare is one of the few things that everybody has an experience in the vertical system, no matter where they fall on the vertical spectrum. If you can start sharing stories about that, sometimes
Second part of this book, Fight City Councilman, and she's about Dr. Vaughn. He was just in place. There are myriad issues that are important to everybody. And it's like, how do we, it's, I think it's easier now. So that's passed. It's still hard. I'm gonna throw out, we need to get rid of Citizens United.
And that's a great connection, you know, I think a lot of people see how this in our campaign finance is, and if you could say something like, okay, might not be abolishing Citizens United and overturning it tomorrow, but in the meantime, we can do things like expansions of the profits plan.
That's surprising how many people don't understand what citizens united is. You say citizens united is something that.
People.
Yes.
That's why it's, and they give as much money as they want to.
But what's good about organizing
Yes, sir.
All right, so again, like I asked you on the last topic, what are some practical, specific goals that you could set for organization? Specific elected official or candidate needs a certain approach to sign. Maybe it's getting a certain number of signers you don't know yet. There's some concrete goals you could set.
Yeah, that was my signature. We're also trading that no matter it's a date, signature. So halfway or we're fine, maybe we can get this story over. It can get way. It's a fun. I think that's everybody. There's intersectionality between a lot of these different systems. But these intersections, things like housing, for instance, just reported last week. President Donald Trump is going to have
The happy face for those who signed and the sad face for those who didn't. It's sad.
And that's a good point, you know, for someone like
That's just a yes or no, you're not saying that
That's a good point. And for someone like Jackie, who, you know, maybe getting Debbie Wasserman Schultz to sign is not a realistic goal, but forming a group of people who are going to harass her for the next 2 years, maybe that's your tangible and achievable.
Yeah, it's a good point. It's not something you're going to get in no matter what. I mean, there's education behind the ice breaking, and I mean, it's a process.
Or maybe your goal is just to aware of some main candidates. Putting friends
Really to go some my friends. So it's very they do. I know that's I will say that our this area come to this and we did I never did Google I mean I've done some thinking but not and it was so once you got the tech it's really not very smart. So it was, I mean, but I felt like it
Okay, so again, 2 minutes to think about.
Free breakfast and free lunches did not happen until suddenly institutions and the United States said, oh, they're the biggest industry. But yeah, what the
So
United States
again, one like usual suspect. And you know, this could be even something like, well, you know, there's a group in my area that does candidate utilities. I would like them to ask about signing the patient part of their enforcement process. Them prepared for just an advocacy. Usual suspect, and then outside of the box, what is their constituency? Affected by a broken healthcare system. It might be interested in helping us solve the problem by working through the patient's work project device that's happening. And then about it down and just thinking your head, here's the suspect, outside of the box. For those two groups, think about what is your shared interest in this group? What are some strengths in this group that who's going to go to person? How can you best approach them? How can you build trust and solidarity?
So I think groups like Americans that are organized. I think there's so much malleability. There's so much malleability. It's just pro-democracy, pro-justice movements, right? And I think in many respects they take on the characterization of the people. Like it's just the phase of the protesting take on the character.
Just like get on
The biggest,
hello everyone, it's just like
not having checking what is engagement,
not like last night, it was fine.
things like stream ads, that kind of mutual aid where, there's a lot of, especially.
If anyone feels ready to share,
Even if it's like on a
before
line,
sharing, feel free. While people are still.
I have trouble getting thinking of.
Can I have everybody's attention for just a moment? We're going to be convening in about 10 minutes, so start wrapping up. Thanks.
10 minutes.
I think there's a lot of for that. The only thing like my grandkids are in soccer, that is something like trying to basically that's a good idea. Okay. Constant level.
Yeah.
So that's like soccer. Yeah, ready? Like grandchildren in schools. Take advantage of that opportunity. Agitation plan.
Any enemy? He's so amazing.
I will not get into
Spots in the calendar already receiving and
many different things. There is, there's arts.
Yeah, I've had passing involvement in working with politics for interviews and their questionnaires. That would be the place to get it. Was they profits get that as a line item in their questionnaires, because they would answer.
This is definitely a topic that we're discussing at the national level.
They might not on an individual level, but the party says, "Hey, have you signed the pledge?" Or what do you think of the pledge? I think it might move.
Any other outside responsibilities?
I was thinking about all the retirement found out. How we can be that system, the last lawyers asked.
I live in a. What did you think?
Why didn't I think of it?
That's inside of this.
Okay, thanks everyone. I'm sorry to rush this a little bit, but I want to make sure there's time for the third bucket of work, which is the deprivatization of Medicare and Medicaid. Was talking about this. It's happening to privatize Medicare and Medicaid. This is happening at the local level and also at the state level. So, I think you gave us some great context of why that's really, really important right now. But any further thoughts about why we think this is an effective strategy at this moment, or any reason why it might not be a great strategy?
Well, the retirement community you just got brought up, and that's where so much of the spending that's on that advertising on TV for Medicare Advantage plans. Oh, now's the time to change your plan because we're going to give you $100 a month for whatever.
Yeah.
Which is my tax dollars.
And what I feel in the medical field is people they pay Medicare their whole life and they don't understand that Medicare pays 80%. Was always like this. You're gonna retire with 80% paid, the rest it's up to you. And they not understanding this, they cannot question if Medicare pays only 80%, how come a private company that has CEO, stockholders, etc., can pay at 100% more to me? Doesn't make sense. You know what I mean?
Reauthorizations and denials.
Medicare is gonna give them 80%. And from this 80, they make 150%. Something's wrong.
So that's like an education, you would say,
I
right?
would
Like,
say, yeah.
Because
Because people, they pay for Medicare. We all pay for an employee, for your salary, and you don't understand how Medicare will serve you in the future. So you can question how a private company, I question my patients. And, oh, yeah, really, yeah, blah, blah, blah. Nobody thinks about it.
And that's a strategy. That's no accident that people don't understand. People also don't understand how government works. Even how government is configured. That's no accident. The population of this country has been building
Like that Medicare Part C B. The very next item, Part C, Medicare Advantage. How did it get C?
That should be illegal. It shouldn't even be. They have so much.
$20.
I'm a new. My particular.
There's also food now.
Try to have. Medicare.
That you guys.
Calls you.
Not too low.
Not somebody else.
And they're headed by transplantation fellows. And we actually use it guided by the life administration.
That's so easy.
All right, so this is kind of a wonky topic. Like even I think for us, it can feel like policy wonky. So how's the way we can take this and make some tangible,
actually doing a lot of
specific
looking to example.
Medicare or Medicaid.
And then
I think it's Dr. Seuss was that we have to and make that if education is a public good, transportation is and the more people say it's not for profit, it's a public good and you deserve it. I think that's it's a lot to do, but I think if they people think that health insurance is public because of Medicare or whatever, because of such a we need to say public good means pay for it for the government. That's the way I think they would accept it if they knew that it's a public good, we pay for our service.
Yeah, I was gonna say, far data with people.
We pay for our parks, but if we say if it's a public good and we're willing to pay for what we get, even though it doesn't make a profit, then I think that's, I mean, I think it's a way.
Also,
Yeah.
maybe someone can help you this, that I hear from them, mainly South Florida because of the Canadian.
All right, folks, we have just 3 minutes left, so we want to wrap up our conversations and come back to our group. All right.
And they say the Canadians come here to themselves. I know it's not true. Maybe a million, but it's a regular Canadian. But they say, I don't want to be with. I know Canadians that come here to use our city. And I don't have a name. She never won.
You know, that's so that brings us back to the only have specific goals that we set. Maybe you have family members you want to educate. What Medicare Advantage is. Or maybe you want to set for yourself doing a presentation in your to a retiree group or affected by this to educate them. Your specific stuff.
Back to basics, a letter to the editor. Even though nobody's reading newspapers anymore, but still, I mean, somebody is.
Send emails to friends that you haven't talked to.
Yes, I love that.
I'd like to target groups that are about to. Because, yeah, the people who, this is my, they advertise so much, like you were saying, under Medicare Advantage, that like, everyone's going to someone into it.
But I'm also, I've known Dave that's
Okay, so we're running out of time to do the thing where you think of the two groups, but I want you to that's your homework. If this is the topic that really spoke to you, maybe it's not, maybe you're more fired up, you know, one of the other great topics. But, you know, if this is one that's spoke to you, I do encourage you to take the time to think about that. What are two groups that you could carefully conversation on your specific goal? Maybe it's someone who's gonna co-author an LT with you. Maybe it's a family member you're gonna recruit to come talk about election. It's not hard election. What are some specific groups that
It's like, if you could position capturing the main stage again, that would be great.
Okay.
and how can we best approach and be trusted?
Awesome, Alex.
Yeah, you're great. Thank you, thank you, thank you.
It's the preschool teacher.
All right. So
It's the nurse.
it is 12:30. I know everyone is really embroiled in conversation, but I also know that there are some folks who need to get back to the airport soon. So I want to make sure we have a chance to come together as a group.
Let's meet. Okay. Great job on your.
Thank you.
And people should get. She must have a 40%. Yeah, so if you do the good first from that one, the things this like is gives yourself a lifetime.
Yeah.
Just noticed like I'm actually Where do I record that? It's amazing, like how we can hear about this. Gotcha. Oh yeah, no. I like that. That's fine.
Carry that over until they get home.
It's like, all right, if you can hear me, clap once. If you can hear me, clap twice. Is everybody ready? Are we excited to bring this thing home? Yeah? All right.
So I couldn't reach her.
I'm gonna say when we fight. All right, okay, I see you played this game before. When we fight. When we fight. When we fight. All right, we're gonna do better than that in just a minute. All right, folks. So, thank you all so much. Yeah. Everybody said, everybody ready? We good, we good, we good. All right, fantastic. Thank you all so much. I overheard some of your conversations and they sounded really, really cool. How many people thought they had a really useful conversation today? Awesome. How many people thought of a new group to reach out to that they had never thought of before? Okay. Honestly, even if it was like 2 of you, I would have been happy. Because we got to start thinking outside the box. All right, so group one. Who's group one? Woo! Awesome. Do you want to just give us a little bit of a quick back of some of the highlights of your conversation?
Sure.
Awesome.
Here, yeah.
Do you know? Of course. Is that okay?
Hi, everyone.
Yeah, we can pass that one around. That's great.
So starting, my name's Chad, by the way. On the pro-democracy front, so I have a lot of notes here, sorry. Wanted to make sure that we push Medicare for All at any upcoming No Kings protests, how exactly we do that, focusing on how with the ACA subsidies having an effect, people are gonna become more mindful, so using that to our advantage. Tying the healthcare collapse to the possible economic collapse. It's important to make sure that we have a coordinated visual message. So what is that 1 or 2 sentence thing that you're going to use to talk to individuals? Some other things we talked about on the pro-democracy front is goals at the local level. So whether that's tabling at local events, gathering signatures, finding local community events to talk about it. And then when we talked about the inside and outside the box groups for for pro-democracy, we talked about inside the box being organized labor, steelworkers unions. Outside of the box, we talked about school boards and PTAs. Also, an interesting group that we hadn't thought of, or most of it hadn't thought of, were veterans groups. So Eagles Lodges, things like that, where maybe you don't align on a lot of things, but there is some common ground. When we covered the patients over profits pledge, we talked about an effective strategy for that is, for those who are aware, like the APAC tracker that's out there right now that tracks, where that funding is. So
if there's a way to centralize, it's obviously, there's tons of for-profit companies, there's tons of different prescription companies and lobbyists, so it's not just one organization, but being able to maybe put that down publicly so that information is available for everybody to kind of guilt people and to be like, hey, if you're okay taking this money, we're gonna make sure it's public for everybody. Something else that we talked about with the pledge is that for a smaller politician, they may say, well, why does it matter that I even sign it? Nobody really knows who I am, but it's something that shows that that's a core value to you, right? So, and if you sign it at your first public job, that shows that, hey, this is something that's important to me. It's important to me from day one. So if you sign it on early, it's kind of proving that. We'll just skip through here. Real quick, just jump to deprivatization. We talked about, let's see. We talked about how retirement communities are a massive target of advertising about Medicare Advantage and trying to fight that in multiple ways. So, how do we do education outreach to these groups to get them before they buy into a plan that now they're stuck in and they regret doing because they didn't know before? And how do we find ways to talk to individuals at an age before they retire? So, somebody in their 50s, people just assume, oh, you know about insurance, a lot of people are undereducated. So, finding groups and ways to get in there. I think that's it. Yeah.
That is awesome. Thank you so much. Where do we have group number 2? Group number 2. All right. Yes, absolutely.
Do you mind? Can I just talk? Because I have a loud voice.
You have a nice voice. Are you a union member?
No.
You picket lines.
Improv. I have a.
Okay, there we go. Yeah. Yeah, I know we either picket lines or community.
Yes, and
All right. So yes.
Yes, and.
Zip zap zap. Yeah, for the first one, when we were talking about privatization of Medicaid and making that a known issue, I think what we came to as a group, our conclusion was that the best course of action for that is to prepare and get ready to because the shoe's going to drop relatively soon and nothing gets fixed, and being there in a place where we can have that message and bringing people around to the idea of removing private organizations from our, Medicare or medical stuff is probably going to be the best thing, right? So that was the first one that we talked about. For the second one with the no kinks, I think a lot of it was, similar to what you guys had spoken to in group 1. Some other places that we had discussed as people to reach out to that are kind of outside the box were churches and leaders, local culture centers, businesses. I think somebody threw out the idea of the balloons, or what was the
Puppets?
the puppet. You get some of those local organizations who are the same mind, to help out with that kind of stuff. That's a good place to do that. League of Women Voters, and just finding one person who's connected to everybody to push that message is very strategic and good. I think moving on to the last one with the patients over profits. One of the things we had talked about that I learned that was unknown to me was that Linda has organized lots of call campaigns, and apparently they consider it a busy day for state and even some federal legislators if they get 10 calls. So one of the easiest ways I see is you just organize a group of people and you say, hey, every week on this day at this time, 10 of us are going to call. And we're just going to be consistent about it every time, right? And make it so that it's an issue that keeps coming up to them. So I thought that was a really good idea. And it's so achievable, right? It's something that's so easy for anybody to do. Sorry, my papers are all mismatched. Just general petitioning of elected officials, getting people to call. And then I'll be strategic about it too, right? Targeting people that are on certain committees, and then also making sure that and also try to target your non-allies. Your allies are already on your side, so that's pretty much it.
Awesome. Thank you so much. All right, fantastic. Group numbers 1 and 2 have been pretty good. Who can beat that? Who can beat that? Who's here from group 3? All right.
Dan McDowell from group 3. Oops, sorry about that. Our group, like many of you in this room, we were filled with a lot of A-type personalities, a lot of overachievers, and the first 30 minutes were spent talking about everything we pretty much knew or learned in the last day and a half. I do want to say that we agreed that it was a complex after we kind of realized, okay, we got to come with a strategy here. And we agreed that it was a very complex, it had many factors involved, but we also know that it can be simple. Other countries have done it, we can do it. And in order to do that, we put it into kind of 3 sections and said, okay, what does today look like and what does the end game want to look like? And today is about Medicare for all, or a best practice that looks like Medicare for all. So keeping that in mind, we said, okay, how are we going to hold each other accountable in this circle of group? And that is that we are going to have to say, what are we going to do? And here are the things that we talked about. We said we would research, and this isn't anyone in particular, but in general, we would research. An example of researching would research on organizations such as unions, or queer requirements for healthcare. We would do training for physicians. We would do outreach programs. We would be talking to various organizations. We committed that we would be emphasizing, rallying behind officials, candidates that were supporting what the end game needed to look like. And that we would, not forget about civil disobedience being a part of that. That is a major emphasis. And then we would want to make sure that we would emphasize that we would communicate, educate, and advocate as a collective. Now, with that all said, we said, okay, but when we leave that room, like everybody in this room, we should come back next year with being able to quantify what were our results and hold us accountable. And that's what there's a lot of energy about. Too often we leave the room and that's it. Nothing gets done. So we try to want to say, okay, can you hold us accountable? We're asking this organization to help us do that, to help us put this together, so we can get back to our own group individually, so we can come here next year and actually quantify what we were able to accomplish as best practices.
I love that, thank you. Like you mentioned, of civil disobedience, my own career in movement started by getting arrested at Healthcare in Massachusetts. All right, fantastic. I believe we have group 4 next. Four. Fantastic, 4.
Hi, everyone. I was with group 4 and we discussed all of the strategies, but our group really coalesced around incorporating Medicare for All into the pro-democracy movement. And we had an interesting conversation because it was brought up that we can also incorporate Medicare for All into the mutual aid that we're going to see happening over the next few years. And that's already happening, but also in response to things like the Medicaid cuts and the cuts to SNAP and HUD and things like that. And that was a really interesting point that we talked about as well. And a lot of folks, almost the whole table was from right here in Florida. And so a lot of folks knew different groups that were already engaged in either mutual aid or in those pro-democracy movement protests. And so we talked about groups to reach out to, and Terry and Rick mentioned Florida Rising as one of maybe the usual suspects who is kind of already involved, but we could get them more involved in this. And then James mentioned a lot of different organizations, but one, the People's Free Kitchen, they're engaged in mutual aid, specifically in food, farming, and then using that food to feed folks who are unhoused. And so getting Medicare for all, just even into those conversations when you're having that mutual aid relationship with folks. So it was really exciting, and everyone left the group with a list of new organizations to reach out to and also ways to connect with them. So thanks.
I love this so much. How many people have thought before that we should be reaching out to mutual aid groups? I gotta say, I'm part of like 7 mutual aid groups and I didn't think about it. Okay, great. Fantastic. All right, we have group number 5. All right.
Who's got the, where's the microphone?
Where's the microphone?
Yeah. You can have the mic, comrade, but I'm a little disappointed you weren't willing to go.
Well, for accessibility reasons, I'll go ahead and use the microphone.
Okay.
Hey, y'all, my name's Kate. I was with Group 5. Raise your hands, Group 5. Woohoo!
Yes.
Yeah, we talked a lot about the difference between like, this is the way I'm gonna succinct it, organizing versus mobilizing and building trust. And mutual aid did come up in that conversation and being present and getting away from kind of party politics and talking more about the mutual aid and how we show up for one another, a meeting too. We talked about everybody sort of going through their definition of what a strategy is, and I really liked it circled. Chuck's kind of framing of it as like a strategy is a recipe and tactics are the ingredients. So you have to have the ingredients that match the recipe, right? Or it's gonna go awry. And having clear messaging coming from a person within the community that's being impacted by the policy or whatever that you're talking about and how important that is. We talked about the foundation of education as being important, education around, for our purposes, we were talking about what the hell do the insurance terms mean and like how do you present that in a way that's like interesting and kind of thinking outside of the box in terms of like where we're showing up, how we're showing up, and how we're talking about things. The pledge was something that resonated quite a bit with the group, and the pledge with mechanisms of accountability being very important, and that like if you're not gonna get an endorsement unless you sign this pledge. It is a requirement and it comes with other things and other ways that we're expecting you to show up. Let me see. Oh, and we certainly talked about, the inside, outside. We talked about faith groups, veterans groups, religious groups, as, maybe unusual or untraditional allies, and then of course you have like the NAACP and progressive groups like that who you could reach out to. I think that's what I'm gonna say.
Amazing. Oh my God. I love all of this. How many people just in that report back heard something they hadn't thought about before? Yeah, I have to say, sometimes when you go to conferences, it's a lot of the same people saying the same things over and over and over again, right? But I think one of the most beautiful things about this conference is that we've gotten so many perspectives and we've shared them with each other. And I think I just see so many amazing connections happening in this room. I want you to know that after the conference, you are going to receive a follow-up feedback form. And when I send that out to you, I'm also going to send out a calendar link for me. And what that is a link, you can click on it. And if you're interested in having a short follow-up meeting with me, I would love to meet with each and every one of you. So there'll be a link that you click and you can choose a time if you want to chat. Love to just have a conversation. So we are drawing towards the end of the day. How many people have had an okay time this weekend?
So,
How many people have had a better than okay time this week? Oh, I love that. I love that. I love that. All right, folks, this has been a pretty incredible weekend for me as well. As I said at the very beginning, I've been remote the entire time I've been at Healthcare Now, and so there are a lot of folks in this room who I've been on Zooms with for the past 3 years now who I've never met in person, and it's such a joy to put a name to a face and see people from the chest down. So there are so many people who we have to thank, right? So I want to do 2 things. I want to thank and I'm going to ask. What do you want me to do first? Ask or thank?
Both.
Ask. Both? Well, I'm going to do both. Don't worry, you can't stop me. All right, I'm going to, what I'm going to do, I'm going to thank and then ask, all right? So the folks who I want to thank all the folks who made this possible. This weekend required a lot of organization, a lot of money, right? And people through this room, all of the different organizations involved, they have given their time, their resources, their cold hard cash so that we could have places to stay over the weekend and we could have a beautiful space like this and a nice little cookout and lots of lunch, by the way. There are going to be like 50 extra sandwiches, so everybody can do. All right. So I'm going to obviously I'm going to thank all of you for contributing to this conference, but I also want to thank our sponsors and our movement level sponsors, our National Nurses United. I'm sorry, I don't think you heard me. I said National Nurses United. We have Physicians for a National Health Program. And we're friends of the California Nurses United. All right, now I'm going to read off, I've alphabetized this now. I'm going to read off all of the sponsors because I think just like we spoke the names of the people we're fighting for into existence, I think we have to speak the names of all the people who support us into this space. All right, so we have Center for Health and Democracy. Yes. Central Florida Jobs with Justice. Florida Voices for Health. The Friends of Don Beckler. He was a former Healthcare Now activist, and if you look at your program, you'll see a little tribute to him. And his friends came through and made a donation to support this conference in his name. We have Healthcare for All Texas. We have Healthcare for All Minnesota. Healthcare for All Ohio. Labor Campaign for Single Payer. National Organization of Women Florida Chapter. New Jersey Universal Healthcare Coalition, One Payer States, PDA Florida, People's Action, Progressive Democrats of America, the National Organization, Public Citizen, Students for a National Health Program, and Space Coast DSA. That sounds like a pretty rad coalition to me. I love this. This is great. So thank you so much to all of you. I also want to thank the Healthcare Now board. We've been hosting this conference for Walter, a million years? Yeah. Approximately 2 million years. And I want to thank we have an amazing board full of activists who've been working on this cause forever. So I'd love it, if you're a member of the Healthcare Now board, could you just raise your hand really quick? All right, thank you so much. We've got Judy, we've got Sophia, and we've got Walter. Love you guys so much, appreciate you. I want to thank our planning committee, which was Stefan. Oh my God, I'm sorry, Stefan. Stefan, Jim, Alex, and Jasmine from the Nurses Union. Jasmine couldn't be with us, but she joined us for the early planning. And that's our planning committee.
They planned this.
Could not be more grateful. So really, really appreciate it. Thank you so much, all of our sponsoring, all of our speakers, all of the folks who did workshops. So.
And Gillian!
Thank you. That's very kind of you. That's very kind of you. I love standing up in front of a room and getting applause. But you know what I like even more? Standing up in front of the room and getting money. So not to be crass, right? We're in this movement for the people, right? Yes. Yes, right? I mean, I don't make much money, no one in this, right? We're in this for the people. It's not about profits, and that's why we have this nonprofit organization that's been fighting since 2004 for universal health care. We support organizations all over the country, including Medicare for All Florida, our amazing co-hosts for today. And it's really critical. You know, we're never going to match the dollars, right? We're never going to match the dollars that the health insurance industry puts into manipulating our politicians. The only thing that we can do is organize more people than them. And guess what the good news is? There are way more people who are being hurt by our healthcare system than there are who are benefiting by it. It's a very small group of people. Yeah. So we need to keep organizing. We were able for this conference to really sponsor people who were unable to pay the registration fee, to provide housing for folks, to provide accessibility. We were able to do all sorts of things to get folks here and make sure everyone was fed and make sure everyone had a good time. And so I asked, if you had a good time today, please give a little bit to support. Every little bit helps. Honestly, $5, I would cry with great gratitude, right? That's $5 I can spend making sure that we put one more person out on the street for Medicare for all. Yeah?
Yeah.
All right. Okay. So I have here the QR code. If you want, you can use that QR code to get to our donate page. And I also have the website there. So you can use that to make a quick donation.
Do it. Do it now.
What are you waiting for? Pull out your phones, y'all. Yes, all right. Alex already did it. Who here is going to make a donation today? Oh my God, that's amazing. Wait, all of you who are making donations, stand up if you're able.
Well, if it loads, it's not loading.
Yeah, cool. Yeah. All right, folks. Thank you so much. I really appreciate that. That is wonderful. So, as a conclusion here, I think it's really important to remember the people who came before us. Yes, right. And one of the people who I've been most inspired by in my career is an activist named Assata Shakur. Do we know Assata Shakur? All right. So she said something that's become kind of a mantra for the social justice movement. And I was hoping that we could say it together, all right? So I'll get her to say a line, and I want you to repeat it. But first, what I'd like you to do is, if you're able, could you stand up? And what I'd like you to do is to ask for consent first, obviously. Ask if you can put your hand on the shoulder of the person next to you. If they're okay with it, it's fine. If not, that's totally fine as well. We'll share.
Yeah.
All right. The hand that you don't have on someone's shoulder, can you put it over your heart? All right. So please repeat after me. It is our duty to fight for our freedom.
It is our duty to fight for our freedom.
It is our duty to win.
It is our duty to win.
We must love each other.
Love each other
and support each other.
and support each other.
We have nothing to lose but our chains.
We have nothing to lose but our chains.
All right, everyone, just freeze where you are. I want you to close your eyes. I want you to feel your heartbeat. And I want you to feel that love going into the person next to you. And I want to thank you all so much for being here. You can open your eyes now. Big thanks to Medicare for All Florida. Thank you so much, especially to Stefan, who I promised I wouldn't embarrass here. I feel a tremendous amount of love in this room, and I feel I may be naive, but I really feel that with love, this kind of love and support, we're gonna fight together and we're gonna win.
Yes.
All right, we have one final word.
Thank you. One thing?
Yeah, Alan's gonna come up for a final word.
No, I just want to say, look, one great way to support healthcare now is to get these t-shirts, which there are a bunch of stuff. Let me tell you, this is a great friggin' t-shirt.
Yeah, absolutely.
I got you. Here we go.
Sorry, Walter.
Still available.
I'm going to be the cameragrapher.
And I'll note that we're going to be redesigning our t-shirts soon, so these are limited editions. We're going to get collector's items. We'll be able to sell them on Poshmark for a lot more money. All right. Thank you all so much. Appreciate you. Everybody make sure to grab grab some sandwiches before you go. And yeah. Oh, I'm sorry, one last thing. Did anyone here lose a phone yesterday? Oh, you found the owner. Okay, fantastic. We're all set. Okay, I give up. We're good. Thank you so much. Everyone have a wonderful time.
Let's go get a sandwich.
It's so easy. No.
Okay, how do I shut this off?
Okay.
If anyone needs to go to the airport, they're gonna want to find Stefan. Stefan, raise your hand. If you don't already know Stefan,
How do you take it out?
They need a ride to the airport. Please hook up with Stefan.
This is.
Yeah, exactly. Exactly.
Hey, how you doing?
How you doing?
Good.
I like that.
Okay, we gotta go. Anybody need a ride to the airport? Anybody need a ride to the airport? Because I'm going there now. Good job, Gillian.
I'm just gonna.
You made it.